Hey guys, I just had my second gender clinic appointment. So this video is just going to be me talking about what you can expect from this appointment, just through what I just experienced, basically. In my first appointment video, I did say that this video should come about 2 months after the first video. They did tell me that it would take about 1.5 to 2 months for my second appointment. This was around June, July time, and it is now November. So it took about 4 months for this second appointment, but as you all probably already know, the delays in the gender clinic are usually quite big. So 4 months is not that bad. But I've had it now. I've just come off it, and I'll be talking about my experience. So when the call started, it was quite nice, just basic introductions, general questions. She just seemed nice. The first thing we talked about in this appointment was about transition history. So she just wanted to know about any milestones that I've had in my transition, just from when I first came out up until now, name change, things like that, gender change, all of those sorts of things. I just started talking about when I was 17 and I first came out, and everything leading up to now, 24, and just, explained where I am now and how it's led me here. We then went on to talk about mental health history. So she pretty much let it be up to me where I started, what I talked about. So I started talking about just before I came out, just when I started to realise about being trans and the feelings I went through back then. And then I talked about coming out and how that made me feel. I talked about any therapy I've been through, any medication I've taken, any lows, any highs, and just it wasn't in a lot of detail, but I just went through my experience from back then up until now, and then I explained where I am now. So next thing we talked about, it was physical health, just any health issues that she should be aware of, and we went through that. We then moved on to, so she had my blood test results. In the first appointment, I was asked to do some blood tests for them, although personally it feels like those results maybe aren't as accurate anymore because they were done so long ago. We went off of those results and we just spoke about how my levels are looking. She did say that my T levels are getting there to the level they're meant to be. However, she explained that my estrogen seems to be going quite high. So we went through like what options there was in order to help with this, and it was either changing testosterone or adding blockers. And she explained that blockers are an injection, which I'm not a massive fan of. So we decided to try and change my testosterone first and see if that works. So I have been on 2 pumps of testo gel up until now, and I'm going to be changing onto 5 pumps of Tostran. So the testosterone levels will be about the same from what she explained, just a little bit higher from what I'm taking now, but it should hopefully help my estrogen levels lower down. And then if that doesn't work, we will then do some blood tests to check, and if it hasn't worked, it will then be blockers. Something that was really interesting for me to hear, which I wasn't really aware of. I am 7 to 8 months in. I'm right in the middle, 7 to 8 months. I'm gonna be hitting 8 months in the next week or two. I found out that at around this time, they don't expect you to be bleeding anymore, which I wasn't aware of. I thought that it's quite normal to sort of bleed here and there. When you're taking T, they don't expect you to bleed much anymore at this stage. As we were going through this, at some point, I think it was slightly before we started talking about my blood test results and what to do, and then she went through it in more detail after, but there's a consent form that you have to sign. When I started T, I had to sign this for my doctor and my endocrinologist when I started my bridging prescription. So she asked if I wanted the gender clinic to take over my care, and I said yes. I just feel like they can monitor my results in a better way. And she basically had to go through the consent form with me. Essentially, this consent form is what you would usually go through if you hadn't started T yet and you had your first and second appointments without already being on T, you would usually go through this and then you would be prescribed T. Whereas for me, it's more just to be in their care, carry on taking T, and then be referred for top surgery, etc., etc. What this form talks about is pretty much just what the effects of testosterone have on you, what changes are reversible, what ones aren't reversible. It also talks about risks and just generally tells you about testosterone and what to expect. The next steps from here is I will sign that, send it back, and then we can start my treatment with the gender clinic. The next step for me with the gender clinic, we talked about this in the appointment as well. She pretty much asked what I wanted to get from the gender clinic, and I explained top surgery. That's my next step. For me, that is the next step to take. So she said that once I sign this form and send it back, she will then be able to send me a list of top surgeons. And she's asked me that between now and our next appointment to look through the surgeons, look through all the risks, and try and narrow down and pick a surgeon by my next appointment. I'm quite sure that my next appointment will take quite a while to come, like the last one. So I've got quite some time to think about. This is something I've already thought about years, and a lot of people do want to know if, I know I definitely did when, before my second appointment, if you can try and get your top surgery referral in your second appointment, and the answer is no. I did ask this. I asked, in this second appointment, can that top surgery referral be made? I feel like I've done a lot of research. I feel like I am ready and I know what I want. But she explained basically you need a whole appointment to sort of talk about everything around top surgery and then make the actual referral, just an entire appointment so it can be done thoroughly and properly. So they give you the surgeon list after your second appointment, so after the second appointment, I get my surgeon list, I get the risks, I get to evaluate everything. And in the third appointment is about top surgery, and that's where the referral happens. So between now and then, at some point in one of these update videos, you will probably hear me talk about what surgeons I've narrowed it down to and who I feel like I'm picking. I've already had a look at this, but obviously I'm now going to have to make final decisions. I'm thinking maybe I'll make a separate video just for top surgery. She also spoke to me about what to expect from my top surgery appointment and from my referral, and what to expect after the referral. I mostly just wanted to know what happens after today. So essentially, there'll be a third appointment. We will discuss the referral and who I want to go with for top surgery. I will then be referred in that appointment. After that referral, straight away, I will be on the surgeon's waiting list. Now, after being on the waiting list, I will then be contacted by the surgeon for an appointment to have a chat about what I want and what kind of surgery options I have. And there will also be an exam in this appointment. So speaking to the practitioner today, she explained that there's basically two main types of top surgery. I will go into more detail about this in the top surgery video that I make in the future when I have a bit more information. But pretty much, if you have a smaller chest, you can have a certain type. If you have a bigger chest, you can only have the other type. In that appointment with your surgeon, once you've been on the waiting list, you then get to talk about this stuff and get to explore your options and just feel comfortable with the process a bit more. She then explained that just who would I think would go with me, because some surgeons aren't obviously near my area. So just about who would be able to take care of me after my surgery. She explained about how there would be probably drains in my body for a few days after, which would make it very hard for me to move. She explained basically the first few days, there's just not a lot of mobility and you need people to sort of do everything for you. However, about a week after, when you're recovering, you still need a lot of help. You're able to do a bit more, but you still need a lot of help with everything. So again, this is something I'll go in more detail in when I make a top surgery video, when I have more details on all of this and more information about it all. After today, I'm going to start researching this a lot more. Finally, one of the biggest questions I had before today's appointment, because I came out at 17, I've been living as male since then. It's been about 7 years that I've been living as male. I've changed my name everywhere. I've changed my gender marker on all my ID, and all of this was before diagnosis. So I just wanted to know, do I need to be diagnosed? Am I getting diagnosed today? I heard from a lot of other trans people that after the second appointment is when you get diagnosed, when things start happening. So yeah, that was my biggest question, and I found out, yes, today, after today, I have been officially diagnosed with something. The practitioner was just explaining that she doesn't really like to use that word. I think it's probably because she doesn't see it as something that needs to be diagnosed. It's just a gender. So nowadays, because they've been through a lot of different types of diagnosing in the past when it comes to trans people, like this, being trans used to be seen as a mental health disorder and used to be diagnosed with gender dysphoria, but they've changed that now because it's now not seen as a mental health disorder anymore. So now you get diagnosed with something called gender incongruence, which just means basically a mismatch between mind and body in a gender sense. So after today, yeah, I have officially been diagnosed with gender incongruence. And I don't necessarily see being diagnosed as a negative. For me, it's more of a positive, because I feel like I've been waiting so many years for like validation from an expert to know that this is what I am, this is who I am. There's just a sense of having, because I feel like it's always been me telling myself that this is how I feel, and me trying to explain to other people this is how I feel. So just having an expert kind of validate that this is how I feel, it's kind of, I don't know, it feels like a relief in a way. So yeah, this video has been everything to expect from your second gender clinic appointment. I hope this was helpful. If you have any questions, just leave them below in the comments. Thank you for watching, and I will see you at my 8 months on T in a couple of weeks. Bye.